Today we're going to see the topic maternal physiology. Here we can discuss a detailed study about the normal physiologic changes in the following maternal systems like cardiovascular, respiratory, renal, hematologic, gastrointestinal and the reproductive system. And we also going to describe the implications for these changes for normal and the abnormal pregnancy. Review the nutritional requirements normal pregnancy. Review the components and the reason for the medical evaluation at the first prenatal visit, and also we can give the reason for the routine laboratory test obtained early in the pregnancy. Here I like to give some few points which is very important in the maternal changes and the physiological changes in pregnancy. Dilution anemia of pregnancy. This means there will be a lower hematocrit due to the expansion of plasma volume which is greater than the increase in the red blood cell mass. Bullet points. Pregnancy is a hypercoagulable state, that is an increased risk for the venous clotting episodes. Heger side, that is the cervix appears bluish and engorged. MSAFP, maternal serum alpha fetoprotein. This is the screening test of the maternal blood done in the early second trimester to screen the pregnant women for the fetal anomalies and the chromosomal abnormalities. Bacterial vaginosis. This is a bacterial infection of the vagina associated with the preterm labor and the birth. Rogam, an antibody preparation of the anti-RH factor given to the RH negative women to prevent the RH isoimmunization. Neural tube defect. This is the abnormality in the closure of the neural tube resulting in the spectrum of the anomalies from the anencephaly, that is the no cranium at the cerebellum to spina bifida. Intrauterine growth restriction, pathological condition of the abnormal placentation resulting in an underground fetus. The small for the gestational age, lower 10% of the birth weight. Large for the gestational age, LGA, the upper 10% of the birth weight, macrosomia, and abnormally large infant, usually greater than 4,000 gram. The primary goal of the prenatal care is to deliver a healthy term infant without impairing the mother's health and to identify and optimally treat the high-risk mother. The vast majority of the pregnancies are uncomplicated. The excessive intervention during the pregnancy can result in less than optimal outcome. The cardiovascular system. Here we can see the changes in the cardiovascular systems like the cardiac output increases 30 to 50%, stroke volume increases 10 to 15%, pulse increases 15 to 20 beats per minute, and the systolic ejection murmur S3 gallop are seen in the 90% of the pregnant women. Peripheral vascular resistance falls. Blood pressure falls during the second trimester and then returns to the normal during the third trimester. Clinical significance. Like many of the normal effects of the pregnancy mimic great heart failure like edema, gallops, dyspnea, distended neck, veins, abnormal cardiac silhouette on CXR, EKG and changes. Respiratory system. Here there will be no change in the respiratory rate, vital capacity, inspiratory reserve volume. There will be decreased functional residual capacity, expiratory reserve volume, residual volume and total lung capacity. Increased inspiratory capacity, total volume. Blood cases like and the gases will be the normal pregnant women has a compensated respiratory alkalosis and a diminished pulmonary reserve. Renal system. Anatomic renal changes like kidneys increase in size and weight. Dilation of the uterus. Right side will be greater than left side. Bladder becomes an intra-abdominal organ. Hemodynamic changes like GFR. Glomerular filtration rate increases. Renal plasma volume increases by 75%. Creatinine clearance increases to 150 to 200 cc per minute. Metabolic renal changes. Burn and the serum creatinine decreased by 25%. Increase in the tubular reabsorption of the sodium. Increase in the glucose excretion. Plasma osmolarity decreases about 10. Marked increase in the renin and angiotensin level, but markedly reduced the vascular sensitivity to the hypertensive effects. Clinical significance of the renal changes. Pregnant women are at the increased risk for prone to pyelonephritis. The pregnant women are at the increased risk for the bladder rupture during the abdominal trauma. The hematologic system. Plasma volume and the RBC mass. The plasma volume increases by about 50%. RBC volume increases by about 30%. In the end result, there will be a dilutional anemia of pregnancy. Average hemoglobin during the pregnancy is 11.5 gram per dl. Other hematologic changes like WBC count increases, platelet count decreases but stays within the normal limits. Coagulation system. Pregnancy is a hypercoagulable state. Increased level of the fibrinogen and factor 7 to 10 will be increased. The placenta produces a plasminogen activator inhibitor. Clinical significance. The blood loss is well tolerated during the labor. However, the maternal vital signs do not change for the blood loss up to 1500 cc. Therefore, the vital signs cannot be tested as an indicator of the blood loss. Gastrointestinal and the reproductive system. Gastrointestinal system, like there will be a decreased motility due to the influence of the progesterone, reduced gastric acid secretion. Clinical significance, like a pregnant woman is considered to have a full stomach even if she had nothing to eat or drink for the several hours. Peptic ulceration is rare during the pregnancy. In the reproductive system, the weight of the uterus increases from 70 gram to 1100 gram. Blood flow increases to about 750 cc per minute or 10 to 15% of the cardiac output. Nutritional consideration during the pregnancy. The fetus will be 7 pounds, blood volume will be 4 pounds, breast will be 2 pounds, maternal fat will be 4 pounds, and the anticipated total will be 10 pounds including the placenta and the amniotic fluid, which is 3 pounds. Average weight gain. There is no such thing as the optimal weight gain. The normal BMI is 20 laps, underweight BMI is 30, overweight is 16. Daily dietary requirements. Calories increased to 15 to 2200 calories per day. The protein, there will be additional 10 to 30 gram per day to 75 gram per day in total. Iron supplementation like 30 to 60 gram per day. Thank you. Calcium, which is 1200 milligram needed per day, usually provided by the quart of milk per day or 2 terms per day. Folate, the supplement will be 200 to 400 mcg per day. In women with a prior history of having a baby with the neural tube defect, the supplementing with the 4 mg per day, 4000 mcg has been shown to decrease the risk of the recurrence in the next pregnancy. A pregnant patient is best served by having the healthy, balanced diet with iron and the folate supplementation. Only rarely or other vitamin supplements are necessary. The first prenatal visit decide, is this the patient normal or the high risk? Common complaints of the pregnancy. Nausea and vomiting usually dissipates by 15 weeks. Constipation common throughout the pregnancy. Heartburn, this often worsens as pregnancy progresses. Vaginitis state only if symptomatic. There will be a varicose veins that treat the symptomatically. It may be a open wave or the closed wave with the depends upon the blood flow. Okay. Headaches and lower extremity edema is very common here, and the people will also have the backache. Lordosis, this is common with the change in the center of gravity. Faintness and lightheadedness. Median nerve is compressed at the wrist, resulting in the numbness or pain. Carpal tunnel syndrome will be caused here. Thank you.